Kia ora koutou, my name's Zari. I'm one of the nurse prescribers at Waikanae Health here in the Kapiti Coast. Our Check project was made up of two different projects. We looked at revamping our cardiovascular clinics, which I was predominantly running when I first started here. We also wanted to do a project for accreditation for Cornerstone through the Royal New Zealand College of GPs. So this project ended up being for our Cornerstone accreditation. Merged those together and created our Heart Check project. Cardiovascular disease really is placing a large burden on the health of Aotearoa, also a large burden on our healthcare services. Disproportionately affects our Māori, Pasifika or other vulnerable populations. So any sort of new project that we run, we really want to do that with an equity focus, and also wanted to make sure we increase the efficiency of our cardiovascular clinics. We know in primary care we can really implement preventative strategies in order to reduce or delay the burden of cardiovascular disease and hopefully prevent that from causing morbidity and mortality. We really have a passion for ensuring that any sort of new project that we run has an equity focus, and we sort of echo the New Zealand Health strategy where we want to improve equity and access to healthcare, especially for our Māori, Pasifika and vulnerable populations. Equity in health should really be the cornerstone of any healthcare. We have to make sure we honour te tiriti, and by doing that we have to make sure that all of our populations, but particularly our Māori and Pasifika and other vulnerable populations, have improved access to healthcare and have improved health outcomes. We really think it's important to have that underpin any sort of new changes, and to revisit anything that we're doing and really make sure it has an equity focus as well. We really want to make sure that the people that do come to Waikanae Health have improved health outcomes, and we wanted to do that with our practice project. We wanted to make sure that cardiovascular risk assessments were increased for all of our population, but we really did focus on our priority population. I do really think anything we do in health really needs to be from an equity standpoint, and we do have responsibility as healthcare practitioners to honour te tiriti and to make sure that we're incorporating the principles of te tiriti into our practice. We do know that increased healthcare and increased health outcomes or improved health outcomes for our vulnerable populations will mean improved care for the whole of Aotearoa. And we were really excited to get a Cornerstone accreditation, so we're now a Cornerstone accredited practice. It means that we can continue to use those skills to always improve our practice and continue to implement good practices, and we hope to really keep that going over the next years and improving as we go.